Welcome once again to Social Workers Matter. My name is Dr. Sylvia Smith and I'm your host. And oh my goodness, it's a beautiful day today out here in London, unbelievably. Sun is shining. We thought summer had finished, but it clearly has not. It's still here. And I have a beautiful guest with me today. Andrea, how on earth are you, darling?
I am wonderful jealous because it is not beautiful here in Washington, D.C. We have some weather happening here.
Oh, wow.
So
Okay.
I'm jealous. I should hop across the pond again.
You should. Oh, gosh. Yeah. It's actually unusual, but it's a lovely day. So thank you so much, Andrea, for agreeing to join me. Andrea is going to tell us a little bit about herself, but I just to add some context, I met Andrea a few months ago at an event that we were both invited to. In fact, I think you have a special relationship with the organizer and host of that event, but you can tell us about that in a moment. So we met and then we hit it off, and we had some good chit chat exchange. And then when I recently visited the US, I spent some time in Washington and we met there again for some lovely food and more chit chat. Although you and Adrian were doing more chit chatting because you have the same kind of TV tastes. So I had to sit on the sidelines and just listen to this conversation unfold. But anyway, it's lovely to see you. And today I have you all to myself. No Adrian to distract. So, Andrea, Dr. Andrea, tell us who you are and, let listeners know something of who you are.
Well, I am super excited to be here and can't wait to see where this conversation is going to go. I was sharing with some friends, oh, I'm about to do a podcast. And they were like, what are you going to talk about? I was like, these things just tend to go. So I'm super excited for today. I am a former medical psychologist. I no longer see patients, but have transitioned into healthcare administration and have found that my reason for stepping away from practice first was I got frustrated with the system and knew that I needed to work to change the system that made it so difficult for my patients to get to see me.
Mm.
The healthcare system in the United States really um, is broken. I say that probably, I know I say it several times a week. We have a broken system and we have to fix it. And I could not, my hat goes off to providers who continue to see patients and work on the business side of the house. I knew that I couldn't do it because if I had a patient that needed me, I was going to see the patient and not care about the board meeting. And so when I made that decision, difficult to leave practice, I've been on the business side of healthcare, serving with large systems here in the United States. And just my goal will make my dash work worthwhile is if I'm able to truly impact how we deliver care and improve how we show up as an industry, because right now we have a problem. Now, outside of work, I think I'm a pretty fun person, but
You
I know
are.
we're here to talk about healthcare. But so I think that is my passion and my life work
Mm.
is transforming how we deliver healthcare.
Wow, that's a huge task. And just to get a bit of sort of time frame on it, how long have you um, been in the business? How long have you been, or how long were you a practitioner for? And give us some sense of not that we're trying to
Uh,
find your age or anything.
yeah, I'm 25. No.
I can tell.
So no, I left practice in 2015. I had been practicing for about 10 years. Left practice in 2015 and have now been on the business side for the last 10.
Yeah.
I kind of mixed a little bit while um in the beginning when I started thinking about it, so there was some overlap, but again, I saw that I was struggling with managing the business and my patient load. And so 2015 was where I said, we're cutting ties, no more patients. Uh, I had to hold my malpractice for a little while because, if someone if someone calls, but thank God no one ever sued me.
Nobody complained.
But
Oh.
I did make the break in 2015 to no longer see patients. No longer I let my license expired a few years after that because it wasn't up for renewal. But uh yeah,
Mm.
2015 was the big chop.
Yes, yes. So, I mean, in essence, it's been about 10 years in each. I mean, give or take, in each side of it. So, I mean, even when you were practicing, because I'm sort of curious about this, were you specializing in
Yeah, pediatrics.
pediatrics?
Um,
Okay.
when you so, in mental health, so medical psychology really bridges medicine and clinical psychology. So my work, I often joke that I'm the psychologist that can cure type 1 diabetes. So I worked initially in an endocrinology clinic, working with type 1 diabetics,
Okay.
to look at why were they struggling with their managing
Mm.
type 1 diabetes. And what we found is they're not just in endocrinology, but this is in oncology, reproductive health. You see, there is a mental health component to all things, all medical diagnoses. So, a medical psychologist is a very good partner to the specialist to help their patient load. The patients understand the illness. I'm not an endocrinologist. I don't pretend to be one, but I can certainly walk you through and help you understand. Um, but I loved being able to really impact children. And while any mental health provider who is able to support uh, their patients changes a life, when you do that as in pediatrics,
Mhm.
you truly shape their life. If I can turn them from a life of struggle, especially with little Black boys who are constantly being diagnosed, I think incorrectly. We label little Black boys who are problems with ADHD. If I can get you off of that track, if I can help you not see yourself as a problem, give you confidence, help you with this medical diagnosis, and diabetes in particular is one that's a lifelong diagnosis, right? So if I can help you as a child, I can truly shape your life.
Yeah.
So I love working with kids, but when you work with kids, you also work with parents.
Yes.
So um, I, while my training is in child and adolescent, you have to be able to work with the parents. Anytime there's a sick child, there's a struggling parent.
Yes. 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 That makes absolute sense. Wow. I mean, it's interesting actually that you raised the issue of ADHD because my last guest was he's someone who specializes working with boys and particularly black boys. So, Andrea, tell us a little bit more about some of your ideas around this whole kind of sort of speedy diagnosis of ADHD amongst black boys in your context. Give us a little bit of that before we move forward, because I
Certainly.
similarities. Yep.
So first, with children, pathology shows up differently than it does with adults. So to frame this part of the conversation, let me just say that this is part of the problem with this broken healthcare system is that we only focus on pathology and symptoms, right? So my job was to see a symptom, diagnose it, treat it, and try and get rid of it.
Mhm.
So that is what healthcare is. It is not about making you whole. It's not about finding why you have it. It's not about understanding. It's about here's the symptom, cut it out, right? And so while I never I held the scalpel like during training, but you get to do rotations and things, but I never I'm not a surgeon. My job was to cut out the bad pathology.
Mhm.
So when you have a system that is focused, a lot of those diagnoses come when they're in school. And so you have this broken education system that is focused solely on tests that are obscure, and definitely have cultural bias.
Yes.
So
Yes.
you have these children. I remember when I did assessments, I'd have kids who could pass the test but couldn't read, didn't have any reading comprehension because in schools, they are being taught how to take the test. So they're not being taught anymore. And so when there's a child who learns differently, instead of understanding and looking for how to engage that child who learns differently, we say this is a behavior problem. So we throw them into the back class, the behavior class. That's what we call it here in the States. We put them in school suspension. We put them in special ed. We don't, so we label them as a problem when it really is they learn differently. So maybe this child is just a visual learner instead of a child who learns better through hearing or auditory.
Yeah.
Maybe this is a child who needs to manipulate things instead of just seeing you write it on the board. And so instead of the teacher taking time to learn that, they just say, "Your problem, get out."
Mhm.
So when this child, this 7 or 8 year old boy, is not able to connect in the class and they're talking, they're engaging with their classmate, that becomes this is a behavior kid. So we're going to put them out. Maybe it's I can't hear, and so I'm asking my neighbor because I have a hearing. I'm not able to hear because sometimes parents don't get to take their children to their well child visits because again, here's a broken healthcare system where, and I was guilty of this. My office hours were during the workday. So guess what that meant for my patients? When I realized that, I changed it. So I wasn't always a part of the problem, but maybe the child can't hear. Maybe they can't see. We have a lot of programs here that try and provide free glasses. But maybe I'm asking, like, can you tell me? Maybe I'm embarrassed because I don't understand this particular thing. And since the teacher only has a certain amount of time to answer or to teach a lesson before they have to move to the next thing because we've become robots in education. Um, where this child is not a problem. They just learn differently than the little cookie cutter that some of our school districts are imposing on teachers and educators. Um, I'm in Washington, D.C. right now, but my family is in Houston. And so I hear so much. What is happening in Houston, Texas is deplorable. Um, Teachers aren't able to teach. They are given literally a script to read from. The state has taken over. They've brought in this superintendent who does not care about the children that he serves. He doesn't see himself as a servant of these children, and has brought in, I'm not even, degreed in education, and I can tell you what they're doing is wrong. So now you have all of these children who don't fit into this box that this man has come in. And this is not just Houston. I'm just intimately aware of what's happening in
Yes.
Houston.
Yes. Yes. Yes.
And so you have these children who are then, you have to go. You're a problem in the class. Because the teacher's livelihood is based on these children doing what they're supposed to do in this little box. So you're penalizing teachers for not being able to keep the kid in the box. And now this child has a diagnosis so that we can justify putting them out. And so ADHD is often the go-to. Let's put them on Ritalin. We're gonna medicate them to help them calm down and better participate in class instead of trying to get to the root of what's happening. Now, are there children who are bad and who have discipline problems? Absolutely. But I can guarantee you there's a lot more that adults should be at fault for problems in the classroom than children with pathology. Children are by and large healthy, and we just don't have people who understand how to see pediatric pathology.
Mhm. Wow. I mean, I'm sort of listening to what you're sharing, and I see so many similarities with some of the issues we have here in on this side of the pond, and um, I think what a lot of our systems aren't able to tolerate in any way, shape, or form is any degree of complexity
Yes.
um, or kind of diversion or whatever. So, if it doesn't
Yeah.
fit, it's got to go. I mean, what in your experience, where do parents fit into this scenario? Because
Mhm.
sometimes they're at the mercy of
Yeah.
professionals. So, what's been your experience?
So again, when I recognized that there was a problem, again, I work with children, and the kids I saw were very sick. So they needed to see me. It wasn't just one visit a year, like a pediatrician, your well child visit once a year, right? So it's certainly when you're school age. Babies, infants have much more frequent check-ins, but school age children, you go to your pediatrician once a year, unless you're sick, and then you have a sick visit. Well, my kids were coming to me, my patients were coming to me often. So I recognize parents can't afford to take off of work every week.
Yeah.
I had some patients who had to see me twice a week. You, you just can't, right? It takes three incomes to live here in DC. And so taking off every day is just not, twice a week is not a reality. When you look at children, not just mental health problems, but children who need infusions and things like that. Like when your child has an illness that requires medical intervention, it's challenging. And so what I did was I had late night hours and one, sometimes two, depending on what was going on, Saturdays where I opened my office. But number one thing that parents can do is advocate for their children. Find the practice. There are. I'm while I called myself a unicorn. But I was unique, I was not the only. I'm not the only person who says, I'm going to open my practice at night, open on the weekends. So advocate for your child. Find that provider that's willing to be there at a time where you can ensure that your child gets the care that they need.
Mhm.
Recognize that signs and symptoms present differently for children than they do in an adult. So where you might sleep, all day in your depression in a child looks very different. It's not them sleeping all day. It's not always them, eating or not eating. It looks very different. And sometimes it looks like behavior problems because they don't have the executive functioning and they often don't have the words to articulate, I'm hurting, I need help. It's amazing how old I had to be able to say, I need help. And children just don't have
Oh,
that.
yeah, yeah.
And so parents have to be able to understand that and find someone who truly understands child pathology, so that that person can support and get you the help that you need. You have to fight within your schools. Again, I'm talking about Houston because I know that community. It's a problem here in Washington, D.C. It's a problem everywhere. And I'm sure any of your audience members will say, we know this too. It's not limited to Houston, but you have to advocate. You have to be able to participate. Another reason you can't come to see me in the middle of the day is because you also have to participate with PTA and be a part of the school so that you know what's happening, so that you can advocate for your child. Be that squeaky wheel. So many times parents don't want to create a problem. No, they need to know that you're there, that you're watching, and that you see what's going on. make sure that the people who are in charge understand that you know what's happening with your child. It's the same in healthcare, right? You need an advocate when you're sick and in the hospital. You need someone who is not sick, who has all of their faculties to be able to ensure the caregivers are taking care of you. You've got to do that for your children. Um, and then being active and involved in their lives um, truly helps because you can see when there are little changes. You know your child better than me. There's a reason it's called practicing medicine. Um, my job is to listen to you, listen to what you have witnessed, and take my training to make sense of it.
Mhm. Mhm.
Um, but there is no, again, there's no cookie cutter. We can talk about AI later on. That's the fear I have with AI is things are cookie cutter.
Wow.
And so we've got to be mindful. I went to school for a long time to be able to do what I do. And so we've just got to be, but I need your input, parent,
Mhm.
to be able to help me get to the diagnosis
Mm.
to help your child.
Yeah, because everybody has different circumstances to a degree. So
Exactly.
I absolutely see that too. And I think um I kind of get a sense of the struggle being real for parents
Oh,
who are disadvantaged and
mm,
marginalized. Um,
certainly.
so I want to touch on that a bit. What in your experience are some of the particular struggles for marginalized families? And when I'm talking
Mhm.
marginalized, I mean, black and brown uh,
Yeah.
and others who are not in the sort of mainstream, let's say. What are the particular struggles for them? Also want to know a little bit about how was COVID? Um, you know,
That's it's still a four-letter word.
yeah.
Um, so here in the United States, we say when America has the cold, Black America has pneumonia. And so COVID was like that times 10, right? Because everybody had COVID, and so how it impacts. So what we see, my apologies, because as I'm talking, I'm like, I should have come with some statistics and some
That's fine.
information about London. I can tell you statistics here.
Mhm.
So in the United States, Black women are less likely to have breast cancer, but 80% more likely to die from breast cancer. So that means we find it later, and it's further advanced, which makes it more challenging to treat.
Mhm.
In the United States, Black women are about, I think now we're at 5 to 6 times more likely to die in childbirth, in and around childbirth. So during pregnancy, delivery, and that year postpartum, Black women are more likely to die during that time than white counterparts, regardless of education and social economic status. So whereas most other illnesses have a protective factor, your education, your zip code plays an impact. With maternal mortality, that's not the case. And so when we see illness, the Black community, brown community are more likely to experience it at a more severe
Mhm.
and have poor prognosis,
Yep.
right? So we saw more Black people, Black communities, right? It's not even just, I hate to say just Black people, but we saw COVID impacted Black communities more. There were more deaths in Black communities. When the world first learned, right? I think we all know March 14th. I think that's when the world shut down. That was the day in that was here in the States. I don't know. 2020, March, I think it was March 14th. March 14th, or let's just say March in case the 14th wasn't the right day. Um, but March of 2020 was when the world said, "Oh, this is an issue. We need to watch." But this had been happening, if we're being honest, people were seeing deaths in December of 19.
Mhm.
New York was seeing a spike in deaths. And so I remember flying with a mask. I'd gone to Home Depot because this wasn't a thing, right? So people didn't wear masks back then. And I remember I went to Home Depot
You lot
because
didn't wear a mask.
I
You wearing one.
still wear it's 2025, almost 26, and I still have it on. Um,
Yes.
I went to Home Depot to get a mask, and I remember all of the flight attendants on my flight. Where did you get that? I need that, because there was little discussion. And so, but in New York, we were seeing spikes in deaths that just weren't, we didn't have an account for them, but we pretended just dropped on us in March, and that's not accurate.
Mhm.
And so in March, here in the States, there were people on social media because everybody went to Facebook School of Medicine. And so on social media, people were saying, oh, this is only affecting because there were a lot of reports in the very beginning in white nursing homes.
Mhm.
So this only impacted old white people. Then there were two young athletes that died. And so people were like, well, wait a minute. How did these little 20-year-olds die? Because this is only supposed to impact old people because it's in nursing homes. And again, in New York, we were seeing different things, but that was, again, your algorithm is your truth. And so people were, there was even a joke. I don't know if y'all joke about washing chicken in London, that Black people, we wash our chicken. Do y'all
Yes,
talk about,
yes.
is that something, is
Same
that a thing
thing.
there?
Same thing. Yes.
Okay, so that's the thing there. So so the joke was, oh, if you wash your chicken, you can't get COVID. Like that was the joke. And so people were making fun because I don't think in March, I don't think that people really understood how severe this was. And so we had the jokes, and it was supposed to be a 2-week shutdown, and things were, every day we were learning more. We were seeing this multiply across the globe. And the way we managed healthcare. So then you had all of these clinics closing, hospitals like, okay, what are we doing? We have to convert, we have to stop surgery and stop um, non-emergent care. And so there was just like, we don't know what to do because now all of these people are dying. We don't have enough ventilators. We don't have masks. We don't have PPE for staff. And so it became, you see why I couldn't be in patient care? See, I wasn't in patient care at that time. So I was able to be on the ground and really taking care of the work.
Mhm.
And so we had all of these realities hitting us, and you have to make decisions in the moment. So it's easy to Monday morning quarterback and say, you all should have done this, you should have done that. And some organizations fared better because they had better emergency plans, but no, the world was not ready for this, right? This wasn't, oh, this hospital, this state, this country. The world was not ready. It did not help that one of the most, it didn't help that here in the United States, we had such bad information being spread.
Yep.
And so the spread here could have absolutely been different if we had a different leader and different administration.
Yes.
We saw death here in a way that other countries did not because we politicized the pandemic. So only Democrats can wear masks. Only Democrats want to social distance and isolate. Only Democrats can get the vaccine. The vaccine is causing all these illnesses. Still today, people, oh, when someone dies, oh, did they get the COVID vaccine? And so we politicized it instead of letting science make give us informed decisions. We allowed, and incompetent administration to drive that work.
Mm-hmm.
Um, and so what we saw once we I'm doing the air quotes because I still don't think we have our hands around it. I'm actually in the middle of writing a book, and I talk about COVID a lot because it shapes healthcare. You cannot talk about healthcare in the 21st century without talking about the COVID pandemic.
No.
And so I struggle to say that we have our hands around it, but once we kind of understood and had the game plan of the day and were trying to move forward, we produced. I will say that the production of ventilators and getting masks, we did pivot. I will give credit there. Um, um, and so when we started to get our hands wrapped around this, um, again, this politicizing of care and action just made for continued death that I don't think we needed to see. What we had to do, though, was then address the broken trust. So let's go back to the marginalized communities
Yep.
in Black and Brown communities. So by and large, while we didn't provide the vaccines to those communities at the rates that we were in other communities, those communities weren't using them
Mm.
because there's a lack of trust. And if we are going to address the brokenness in the system, I said that at the beginning, we have to talk about the lack of trust. I think that's chapter 4 in my book.
Yeah, and
But we talk about it, right? The
yeah.
lack of trust in the system is why people will listen to someone say, who can't even pronounce acetaminophen, say that it's a problem because they're willing to listen to this office that they believe they should trust instead of listening to the doctor that's in their community. They are willing, the most difficult thing for me here, did you all have, what was that thing called? Oh,
Describe it. What are you trying to?
it was a thing on social media, and you couldn't see people, you could only talk. They I remember when they were beta testing. It's gonna come to me. It's gonna come to me. But this it starts with the C. This social media platform had all of these, like they had rappers and Instagram influencers holding rooms to talk about the COVID vaccine. And I'm like, why are you people getting your advice from a rap artist who didn't even finish 8th grade? Like, why is that who you're getting your advice from? Again, Facebook School of Medicine
The lack of
and
trust.
Instagram School of Law,
Yeah.
but they were more willing to listen to this rap artist than to the doctors at the CDC. And so one thing that we had to do was establish trust. I know we did a number of health fairs at churches because that's a trusted place.
Mm-hmm.
One thing that I did, so in 22, I came to Washington, D.C. I don't want to say permanently because nothing is permanent here, but I took a permanent role. So I came off of the road. I was working for a consulting firm. And so I was just moving all about, hence me wearing the mask
Yeah.
even before the world knew.
Mm.
And so in 22, I came off the road and was here in working for a hospital in Washington, D.C. And we did one thing I'm so proud of was our community health fairs. And so we'd bring the mobile unit out. I partnered with the director, Dr. Hope Rhodes, who is the medical director for our mobile team. We bring the mobile unit out, go into the community, bring out food trucks and snow cone machines, and just like have fun. A couple times we had a DJ. Like we made healthcare fun.
Hmm.
But the thing that I loved was that we also had doctors who were just there to answer questions. The first day we had a little tent called Ask the Doctor, so you could go there and just talk because you didn't have to worry about only having 10 minutes in your visit. We had to reestablish the trust
Yeah.
because people didn't believe. People telling me, oh, they're going to give us something like they gave the people syphilis in Tuskegee. The misinformation. What happened in Tuskegee was deplorable, but no one was given syphilis in that. And so this just misinformation, this inaccuracy, we had to do so much work around restoring.
Reparative work. Yep.
Yeah,
Wow. Wow. I mean, that is it's an epic story in many ways if it wasn't if it wasn't real. Um and I mean in terms of what you're going to be writing about, is
yeah.
this some of what you want to actually relay? Because in a way that's kind of how we learn, isn't it, from what has gone. I mean, 2020 vision is great, but retrospective reflection and analysis is also extremely valuable. What what's your book going to be about?
Healthcare, transforming healthcare delivery. So I don't have a title yet because I said the title will come to me when I'm finished.
You're creative, Andrea, so it
I
will come to you at night in bed or something. Yeah.
I love former Vice President Kamala Harris said when they asked her, she just finished a book, and I'm going to borrow something that she said. I don't want the history of what happened to be told without my voice. Now she's talking about her election. I'm talking about healthcare, right? So
Yeah.
I don't want the telling of healthcare, and certainly how we made it through, that was the air quotes for those who are only listening and can't see,
Mhm.
how we made it through the pandemic to be told without my voice. I wanted to be a part of that discussion. And so talking about Black and Brown communities, talking about the brokenness. I'm a two-time breast cancer survivor. I talk about that because in my story, I talk about why it's such a problem that we only focus on fixing a symptom, but instead of preventing the system.
Yep.
Why not put resources toward helping me not get breast cancer? Why wait until I have it for me to be able to see the oncologist? Why do we make healthcare so difficult? So I talk through why our system is broken and what we need to do to turn it around.
Yeah. Yeah, I absolutely agree, and I'm sure many folk who are listening to this will have a similar view. The whole kind of notion of prevention, and certainly in my world, in social work and social care, that's something that we're talking more and more about. Prevention. Why wait until it gets so bad?
Yes.
It's common sense, but not so common. Um, so how do we fix it?
So number one, I prevention, focusing and reimbursing for prevention. So right now, again, we have a sickness industry where we focus on your illness, we focus on your symptomology and how to remove the symptomology instead of your health. So that's number one. Our system is focused on the wrong thing. Number two, um, our reimbursement is such that so a hospital, if you were to be a fly on the wall during budget season, we're talking about patient days and procedures and how much volume we're going to get through the lab and how much volume we're going to get into radiology, how many births we're going to have in OB. That's how we think to budget as opposed, and that's what the system is, right? The system says you're paid for the symptom.
Well, yeah.
If I want to diagnose you, I have to say, okay, you have this many symptoms. We're on the DSM-5 now, right? I think it's five. I told you it's been a while. I
Yeah,
think it's
fine.
five.
Yeah.
Yeah, we're still on five.
Four was ages ago. I think it's five now. Yeah, four was
Yeah, I think
back.
so. Last time I remember because we were transitioning from 4TR when I left, and I remember the conversation around five and some of the concerns around five. I don't recall anything
I
happening. So
I
I
don't
think
have
we're
an
still on five.
intimate knowledge of the mental health stuff. I sort of came slightly into contact with it when I did some work in the Caribbean, um,
Yeah.
and I was working in a medical school then, and I had to have something because I was doing some instructing, so I had to kind of engage with
Yeah.
it. It must be five by now, man.
Yeah, I think so. And see, and that was the other thing, right? It was if you're in the hospital, you really do the ICD-10 codes, not the DSM codes. So it's, it just depends on your setting, where and what you use. But I have to diagnose you with something. And so I spent my time trying to check a box for a symptom instead of, again, getting into the what is happening. And so if the system would transition from fee for service, which is, okay, you get this blood work and I give you a bill, you get, three labs instead of one, so your bill is three times higher. If we change that to actually reimbursing for managing your health, keeping you healthy, what would it be like if my doctor got a check because my BMI went down? Not because I came into the office, but because my hemoglobin A1C was, you know, coming down. What would that look like if that were the criteria for provider reimbursement? What would it mean if psychologists and social workers and licensed professional counselors could actually see people before things got bad to help them prevent? I'm not quite sure. You have to wait until you have, so many symptoms to get to mild depression. Well, what happens if I can see you before you have the symptoms, but you're just feeling a little off? So that you don't get to this diagnosis. Why do we wait? So that's number one. We've got to control the price of healthcare. The pharmaceutical industry, the pharmaceutical companies have far too much control.
Yeah,
Um, and then I think we've got to get more provider minded people into the decision-making space. So right now, it's really the insurance companies that make the determination of what care looks like. So my favorite role was working for Kaiser Permanente, because Kaiser is actually an insurance company before it's a hospital system, right? So they do have hospitals, but they're an insurance company. So at the end of the day, my job was to manage what we were going to provide to our members for their care. Now, Kaiser is unique, right? So, like a Blue Cross and an Aetna, they don't have the Permanente side. They don't hire the medical group that provides care. Blue Cross lets anyone, like when I was in practice, I was paneled with Blue Cross. And so anyone with Blue Cross could come to see me. I didn't work for Blue Cross, but Blue Cross said, we've done our vetting and will allow her to see our members. Kaiser actually hires through Permanente, the medical group, the providers. And so unless there is no one within Permanente that can care for you, all the care is held within Kaiser Permanente. And so my job was to oversee the behavioral health for the Northwest region. So when, we had review committees, and before it got to my desk, there were, several steps before it got to me. But at the end, if a member didn't like the denial, they got to talk to me.
Mhm.
And it's something when you're talking to a doctor, when you're talking to a provider, and not a business person, not an MBA.
Yeah.
So I am so thankful that Kaiser said we need somebody who knows the business and the medicine to lead this work.
Mhm.
And so I will forever be grateful for that experience, because that's what we have to do, is have people making decisions on healthcare delivery who actually know healthcare delivery. And so when you have, here in the United States, we've had a number of assassinations, but the assassination of the United Healthcare CEO sparked so much controversy. And what is the most discussed is people, there were so many people who tried to make sense of it and say, well, I get why it happened. Because there are so many people who are disenfranchised with this broken healthcare system.
Um,
Now, I will not now or ever condone murdering someone, because guess what? That man did not deny your care. Did he lead an organization with practices and, uh, but on his worst day, he did not deserve to be gunned down. So let me be very clear. But the fact that there are so many people who here in the United States said, but I get it. I watched my mom suffer because they denied her care. I watched my grandmother not be able to get the resources. And it's not just United, right? This is not a United issue. This is all across. The time I had a patient come in my office and let me know, um, which again, having someone who delivers care have the final say is critical,
yeah,
not an MBA who has no idea, who just sees numbers.
yeah, yeah.
Um, I think we have to reestablish trust. There are just too few people who believe when we say, this is good for you. Um, we started off talking about the ADHD and how much I hated to see these boys getting black boys on Ritalin, and now I'm saying, but trust us, go get this shot, go do this. And so, but we have to build a system where people trust us. We have to have um, people who are delivering care who look like the people that they're serving.
Mm.
One of the burdens to healthcare that will come from this new bill here in America um, is the loss of funding for like there's a lower cap for funding for healthcare, for not for healthcare, but well, yes, healthcare, Medicaid, Medicare, SNAP, all of those things were cut. But even the education. So there's concern that fewer people of color, fewer of these marginalized people. I don't come from my parents couldn't send me to medical school, dental
Have
school,
access. You won't have access.
my parents couldn't afford to do that. So, but for the loans that I have, I wouldn't be able to do that. So now if we're taking that lifeline
Mm.
from the community, then what does that mean? So who does that mean doctors will be?
Mhm. Mhm.
And so how do we bring, so that's what, there's so many, and to tackle each of these issues will take so much time and effort and energy and resource. But I think if we can address those four areas, we can truly see an impact to healthcare delivery and health outcomes improvement.
All right, let me just run through that again, just in case I've got it wrong. So prevention, um, appropriate reimbursement, and this is obviously the US context, but I think we
Yes.
here can absolutely learn from some of the messages you're sharing. We've got you've also stated price controls need to be
Mhm.
implemented. and then people who are more provider minded be at those
Making the decision.
decision making spaces. I mean,
Mhm.
I think, I suppose
That's
what's
easy. We can do that tomorrow. That's
what
easy.
I was going to say, snap,
I
snap.
mean, it sounds easy, right? Doesn't it? It sounds easy,
Yeah, but
but this has been a chokehold for us as an industry because to say we're going to take the controls and put regulation, that's the hallmark of the United States is this free capitalism.
yeah,
So to say we're going to put these controls over pharmaceuticals to completely flip the reimbursement upside down, that takes so much and people are afraid to tackle that. But the reality is if we don't one other thing that I didn't mention that I'll add, so a fifth one would be so we used to call them social determinants. People are calling them different things now, but those things like food insecurity, water, housing, education, transportation, recognizing the link that all of those make. So if you're not able to get good education, what does that mean for your SES in the future, which does impact your health? The zip code you live in determines your life expectancy. How sad is that? That literally my zip code here in Washington, D.C., I did this study or I did this article in 23. So in 2023, the life expectancy for a person in Ward 3, which is the most affluent in the district, was 94 years. The life expectancy 5 miles away in Ward 8 was 60 years.
wow.
5 miles.
30 years, 30 over 30 years difference.
Over 30 years life expectancy. So your zip code matters. So if you're not getting education and not able to get a job, then where you're going to live is going to that impacts your life expectancy. If you're living in a food desert, if there are not sidewalks for you to be able to exercise, that impacts your health care. And so recognizing and putting resources, again, um, there isn't an ICD-10 code. There isn't a DSM code for groceries,
Hmm. Hmm.
but that matters
Yeah,
in your healthcare. And so how we look at healthcare, again, not just the symptom,
holistic.
but this context of health
Yeah, yeah.
is what we have to do.
I mean, Andrea, even listening to the enormity of the transformation that's required, right?
Yeah.
And the dismantling that is
Mhm.
required, it just feels absolutely overwhelming. But I think
It's why I drink. No.
put it away, put it away.
No.
She's only joking, all right. She's only joking.
I mean, but
Those of you who are
I'm
listening,
busy. I'm
she's only
busy.
joking.
No, but it is. It's a huge weight, and I think that's the problem. It feels like you have to boil the ocean, so people just rather not deal with it because how do you dismantle this whole system? I can't do it, so I'm just gonna work within, and that's what has happened here. Is people have just said it's too big to
Yeah.
try.
You see the other thing that I suppose that concerns me, especially in our context in the UK, is that the politicization of some of these issues
Yeah, yeah.
continue, and
Mhm.
we have governments trying to more or less emulate what's system in, let's say, in the US. Um, and then when you speak to people who are actually on the front line, who are involved as you are, in the whole kind of system of healthcare and health provision, you get the real story. Uh,
Yeah.
and I suppose my next question is then, in and identifying all the sort of challenges and the difficulties and the potential poor prognosis of it all, where do we even start?
Mhm.
And
You know,
have you got a strategy for that?
My family is terrified because I've said I'm moving to Dubai, and I've said it so many times. They're like, "Is she serious?"
You said
So I'm about
it
to
when
be
I
in
was in
Dubai for the
Italy. You said
second
it to me.
time. In wait, say that again.
Said it to me when I was there. Yeah.
So my 7-year-old nephew he only gave me his blessing if I promised to get him a Bugatti. This is my 7-year-old nephew who was like, "Okay, Mimi, you can go if you get me a Bugatti." It's like, how do you even know that word?
Isn't it a car? A sports car or something? Oh, good Lord. All right. Yeah, cool.
I'm like, little boy, go away. But so he's giving me his blessing. So hopefully the rest of my family will follow suit. But I said we will never fix this if we think only the United States can do it. I went to Dubai in April, and I fell in love with the idea. Number one, that's a culture that takes care of their people. There's no homelessness. The Emiratis are not homeless. Emiratis are not on the street like the veterans here. Americans are on the street, poor, hungry, without home, without food. Yesterday, I walked out, and I live in a nice area of town. Now, I'm not in Ward 3, I'm in Ward 2. So that's, but still, right? I live in a nice area, but I also live near a hospital. And someone left the hospital and only in his hospital gown, walking the streets. Now, can you imagine? So, when that doesn't happen in Dubai. Dubai does not let that happen to their citizens. And they make sure that people who are coming there have a way to sustain because that's not acceptable to have that poverty and brokenness. And so they take care and they hold people accountable. You can't come here if you don't know, if you're not going to be able to sustain yourself, because we're not going to have you living on the street. Um, and so this notion of taking care of your community is like nowhere I've seen before. The second thing, I read a book called The Shake CEO, and it because I was just so we talked about how this is such a big idea that people just are like, it's too big, I can't do it. And that was the opposite of Sheikh Mohammed. He's like, make it happen. And I want to be around that energy. I want to be around people who believe there's nothing that's impossible. And that's the mind frame there. I see it, I want it, I'm gonna get it, I'm gonna make it happen. Now, let's be clear. The resources that the royal family in Dubai have,
They
they're
have
different than me.
yes, yes.
So
They have a
I'm
few more
not I'm
shillings.
not
Yes,
oblivious.
yes, yes. They have a few more
I
shillings.
can't just speak it and it happens on the corner here. But I want to be around that. I want to understand that. And I feel that no longer are we the leaders here in the United States. And I want to be around the best and understand, like, how do you all make healthcare happen? Why aren't your people dying like this? Why aren't women dying in childbirth over here? What are you doing that your women are living? Why aren't people getting breast cancer over here? What are we doing wrong? And if we stay here and just continue to do the same old thing, we'll never improve.
Well,
And I don't know what we're doing wrong,
yeah, I mean,
but I know that I need to go somewhere that it's being done right. And so I have, I am a woman of faith. That I think was one of the challenges that my family had because I am a Christian, and they were concerned about me going into a Muslim community. But I'll tell you, I saw no while I was there, the embracing of other, the like I felt safer there than I do in my neighborhood. I did. Um, every day that we turn on the TV, there was another just Sunday. Today is Tuesday. On Sunday, there was another shooting, and this time, not only shooting, but set the church on fire. So it's happening every day. We've become immune to it. We're apathetic to it. School shootings, church shootings, like just mass shootings. No long like we never be able to get out of that cycle. And so I've said I am very serious about going overseas. I happen to love Dubai because I love all things grand. Um, and but there are other countries that are doing this better. And when we stop pretending that the United States is the only place that we can learn and understand, I think we'll do so much better.
Yeah, well, I think you made a great point there, and unfortunately, I suppose white supremacy plays a big part in that. This refusal to accept other lived experience,
Yeah,
other
yeah.
there are other knowledge bases that we can learn from. Um, so, I wish you all the best because, um, as you say, keep doing the same thing and expecting something different is a version of an insanity. So,
Not a version. Look, it is. You're trying to be
I,
nice.
I try to be diplomatic.
What is happening here? People like, why don't we understand this? We can't keep doing this.
Same thing.
Um, I have the great honor and privilege and burden of serving on the fetal and infant mortality review for a county in Florida. And there was one point where I almost got put off the committee because now I don't live in Florida, so I've always questioned, like, are y'all sure you want me? Because healthcare is local. So much of what happens with healthcare, you need to know the community. That's part of the problem with federal decision makers, because what you need in Montana, where I lived, I tell people all the time, I live from Montana to Manhattan. And I guarantee you, you need a different system in Montana than you do in Manhattan. And when you try and put it all in a box, that's where we have a problem. So when I almost got put off this committee, so all of the cases come to us um, with no identifiers, right? So I don't know who this is. I know the race of the mom, I know the age of the mom, but I don't know which hospital, I don't know the names, I don't know the doctors. Because I've been doing this for a while, I can kind of tell styles of note writing, but I don't even know who it is. I can just say, oh, this is the same doctor from, 2 months ago, because you can see people's style of how they dictate. Well, it became clear in reviewing a case we had seen the same mother 3 times. So this mom has lost 3 babies. I've been on the committee for 3 years. And when it came out that this mom was pregnant for the fourth time, and the committee said we weren't going to do anything to do outreach for the mom because we're about the fetus and the infant deaths, they saw a very different side of me. So much that now we have community guidelines that we have to sign every week. I mean, every month. They send
Hey,
us community guidelines. And they're like, well, let's remember how we talk, because they saw a very different side of me, because this was a Black mother. And I was sick and tired of seeing this Black mother before me. And she's pregnant again. And I said, she better not come before us. Now, I am so thankful. I did miss a couple, but I do not I do not believe that she lost the last baby. I believe because again, we don't know as the reviewers, but the people who give us the cases know. And I don't care what the rule is, we break the rule. And that's the problem. We have these rules that are stupid. we're gonna let this child die because we don't focus on the mom. Like, make that make sense. Well, go call her because she could lose her baby. Like, I don't care, just go do it. And so I got angry. Do you hear do you hear it coming? So can you imagine how it was in the moment? Yeah, yeah. So now we have community
It's kind
guidelines
of
and
tame now, but
standards.
I can imagine. Oh my
We
goodness.
have some standards now about how we have to communicate with each other. I say that to say, though, watching these babies last month, this month, September, all of the moms were Black. My friends and family know the day that I do that because my whole countenance, when I have to do that review that day, so we get the caseload to review because we're supposed to read them and be prepared to discuss. But the day that we meet, my countenance is very different because I am sick and tired of reviewing these cases and having to remind them about cultural incompetence. We had one death where the mom was begging, the mom was in and out of the ER begging for help. Mom was in the ER for herself and for the baby, bringing, oh, everything is fine. You're just tired. Tired. I am sick and tired of this. My sister, my youngest nephew, he's now 4. Um, when my sister delivered, this is, the middle of the pandemic. Um, and they had 2 young children. So at the time, her husband decided to stay at home with the two, let me see. So 4 years ago, the 3 and 1 year old. So he stayed home with them. And so I was going to go and be, because, it's the pandemic, so you can only have one person. So I'm with my sister. But the assumptions that were made about this single woman,
Yeah.
how have you not read her chart and you're delivering care? You should know she's married because that's in her chart. You should know that she has 2 young children under the age of 5 at home, but you don't know that. But you're about to deliver. And guess how dangerous it is for you to not know that? Because then that means you're not clear about the things that you should be mindful of because of complications from having children that close together. Now, I call her fertile myrtle because I say, I'm gonna need you to get this together. You got to get this together. But I could say that. But the fact that the staff didn't know that they should be looking for this. So the nurse told my sister because she was complaining about pain and she had a horrible experience, had a cesarean, or everything that could go wrong went wrong. And um after the fact, like my nephew, he was in the NICU for several days. He wasn't breathing. My sister, because you just don't know your child is in pain. So my sister tries to get off of the table, which is not safe in the middle of a cesarean, right? So you can imagine some of the complications she's dealing with because she's trying to get to, because nobody is communicating about her baby, loses more than half of her blood volume. And the nurse tells her, you just had a baby, you're tired. So remember I told you about the community guidelines?
You lost it then.
Okay. Okay. Um that was not a good day for that nurse or I. And I sat down with the chief nurse. I said, you need to go Google me. Don't let these Peloton leggings, because I'm sitting here in this hospital for 5 days because we should have been gone, but your people messed up. Don't let these Peloton leggings fool you. You need to go Google who I am and no, I'm not playing with you. My sister will not die in this hospital. And the fact that you have to have somebody who can threaten the hospital.
Mm.
But watching my sister beg for care and me having to do everything but physically grab somebody to come to her, me having to show where there were errors in her medication, errors in the time she was given the medication and the medication she was given. Um, and I had it all documented. And I said, it's not even about suing the hospital. Yeah, we can sue them, but if my sister's dead, my nephew, what does their money mean to me? So you need to fix this. We can talk attorneys and all of that. You're gonna fix this because she's not gonna die. Because I don't need the money from you. Fix the care. And that is the problem. That we have a system that you have to all but threaten the life of somebody to be taken seriously, that you would make assumptions, that you would tell a Black woman, you just had a baby, the pain you're experiencing is what you're supposed to experience. That's not the case. Did you see that she just lost half her blood volume? Let me see your policy on transfusions, because according to your policy, she should have had a transfusion right then. But if you don't know to ask those questions, what happens?
Oh, wow. And I mean,
So we have got to go. I'm sorry, go ahead.
no, I was gonna say it's a similar scenario on this side of the pond as well, particularly for Black women. Um, it's got to change. It really does.
Yeah, yeah. I am never apologetic. I apologize to the nurse whose feelings I hurt because I told her what I thought about her in the committee, not at the hospital. The hospital, I let her know and did not apologize because she was wrong. But the nurse on the committee in Florida whose feelings I hurt, I apologized to her because I said I didn't intend to hurt your feelings, but I don't like what we're doing. And you are wasting my time if I have to come and sit and just listen to death. Why are we not doing anything about the death?
And what happens? People become desensitized.
That's it. Like, I mean, this is the death committee. Why would we not have, like, I remember reading one of the cases one time, and I was like, certainly this child is not gonna die. Why am I reading this? Because I'm like, this is perfect. Had everything documented properly. Because many of our cases, I say, I can't make a decision because I have no notes because we don't have records. So, and so I get frustrated with that. But everything was perfect until it wasn't. And I remember reading, thinking, why do I have this? This is healthy, baby. Everything is okay. Because usually you can tell the story. I mean, if it's in front of me, it's a death. There are no near deaths that come to this committee. But usually you can see signs leading up, not this one. And there have been a number of those. Everything was perfect until it wasn't. The reason malpractice for obstetricians is the highest is because of how long you can sue for something that goes wrong in delivery through your life. So obstetricians have crazy, crazy malpractice premiums. I know a number of them who are like, "Oh, I don't deliver anymore. I don't do that." But the ability to act in a second.
All that's required.
So we've got to do better. We've got to do better.
Okay, I hear you, Andrea. Listen, it's been absolutely brilliant talking to you, but there are two more things I want us to
Okay.
touch on before. Well, no, three actually.
Okay.
Three more things I want us to touch on before.
Okay. Sure.
First off, I want to hear your views on AI. Secondly, I want you to share with our listeners some of the charitable work that you're involved in, because that's how we met.
Yeah, yeah, yeah.
And then to finish, I want you to tell us about your self-care.
Okay. Sounds great.
Sane, and what do you do to keep yourself?
Yeah. Yeah, let me start with that one just because that's the easiest. I'm a Peloton. Look, when the world shut down, I used to go to the gym and I enjoyed the gym. That was my space. But when the world shut down, I still needed an outlet. And so I have all of the things. I say Peloton really needs, I'm hoping somebody will send a link or to a talk that I give where I talk about Peloton because I talk about them so much. I'm like, Peloton needs to bring me, like, I need to be a part of their their team. I
But
have all the things. I have the Tread Plus, I have the Bike Plus, I have the Row, I have the Guide,
my
I
goodness.
have all of the weights. Um, Now, if I use it as much, I was on it. I did not miss. So there are those. If you're in the Peloton world, you know the Blue Dot crew. I did not miss a Blue Dot. I will tell you now. I have so many meditation Blue Dots.
Okay.
But so I have to do better. But that protecting that space is so critical to me. And I once I was no longer afraid of travel, I've started doing more personal travel to just be able to disconnect.
Oh,
So get yourself a Peloton
I'll have to now.
or the app, because again, just like in healthcare, there are certain things that are not, everybody cannot afford a $3,000 bike. Everyone doesn't even have a home that has the space
Yeah,
for
yeah.
a bike, right? So let me be clear. I say that in jest because I am so thankful that I have the means to be able to have these pieces of equipment. But if you cannot afford the equipment, you can get the app. And the app gives you access to everything. So you can do the workouts, you can do the walks, you can do the yoga. So get yourself the app. If it's not Peloton, I think the world of Peloton, I have loved being a part of the community, but there are other communities. Peloton may not be for you, go to Soul Cycle, do whatever. Um, I think this is the more well-rounded because we have something for everyone, but you've got to take care of yourself. You cannot pour from an empty cup. I'm a woman of faith, and so my faith is important to me because I do a lot of travel. My people often tell me, so I told you people know when I have my mortality review day. They also know when I haven't been to church because you can see how frustrated and just my countenance is different. So find whatever, if it's not faith, but find your space. If it's journaling, if whatever it is for you to be able to pour into yourself because you can't pour from an empty cup. And then finally, I believe in retail therapy. So go buy you a bag.
We know that, Andrea. We know that. God. A
I,
pair
I love I
of
love some good
shoes.
retail therapy, and that's from the doctor. No, I'm talking about write a prescription, please, so I can use my FSA for this bag. I'm teasing.
That's how you want to transform the
I
healthcare
did
system.
not get people in trouble. But I did use my FSA for all these Peloton pieces of equipment.
Okay.
So, but no, again, pouring into yourself. The reason I wanted to start with that because I think the other two are a little more weighted. AI is a wonderful opportunity and one that, again, this is where that politics, right? How much regulation do we need? We've got to be careful. We have got to be careful, especially in healthcare. It's one thing if you want to be, write articles and editorials using AI and chat GPT. I don't care. I am concerned about this generation of college students that are using it for their dissertations and things. I'm like, but do you understand research? Like, do you know what an encyclopedia is? Do you know how to
Sorry,
do anything outside of
I'm an
uh,
educator. We're watching them. We're watching them.
yeah, yeah, but it scares me. I was like, I came of age when Turnitin, like you have two words alike. Turnitin was flagging you. So, um, I am worried for the um, status of education, but the implications in healthcare when your skin complexion is not recognized by the tool that the hospital is using to diagnose, then what happens? So AI is only as good as what it has been programmed to do. And everything, how I show up, if I were a twin, I love the twin studies when they use twins to understand disease. identical twins because they're the same DNA, right? Um, if if my twin and I'm not a twin, but I'm saying that in the context of this conversation, if my twin and I show up, the doctor should hear us and recognize that there could be a difference in our presentation. And I look now, my sister, who I do have a sister, I told you all about the issue with her delivery. We grew up, same mom, same dad, same house. I'm a little older than her, but um, same home. Our worldviews could not be more different.
Okay.
Um, our realities are so different.
Yeah.
And so if we don't understand little things like parenting style and food choices are different, imagine how dangerous it is to use a tool and think that everybody is going to present the same way and a computer would be able to distinguish between. So AI can help us. I hate dictating notes. We were joking, this note taker. I don't know how to take advantage of it because I don't want people to feel uncomfortable about having it on the Zoom. I love being able to have something dictate my notes. When I was in practice, again, it's been a while since so that wasn't a thing, but dictating notes and that was the hardest part of the day.
So
Like, oh my God, I have to write this.
it's
I
a
gotta do my
game changer.
patient notes.
It's a game
So those
changer.
types of things,
Yeah.
game changer.
Mhm.
Diagnosing, absolutely not.
So much.
Absolutely not. And so I think that there is a place for it, that I can be talking to you and say, I need a statistic, and I can go to Chat GPT and tell me what percentage of Black women die in childbirth. Now, because I know the work and I know the research, I can verify because Chat GPT could give me something wrong. And if I don't know the research and I don't know the work, I can't, I just say what Chat GPT told me. But it is amazing that we have that tool at our disposal, but how we use it is where I think there has to be regulation. It cannot be. I remember being in practice, the when you do assessments, I got in trouble when I was a resident because I refused to use the tool that would, like you put in the scores of the patient and then it would feed out a report. And I was like, mm-mm. You know how long I went to school? That thing can't tell me about my patient because you don't know about the family. All you can do is give what a profile would look like for a person who has these scores. My job is to take all of the other tools that I use. So if I use this one particular tool and three other assessments, I got to bring those together along with the family information and the school information. So I think we have to be very careful and we need some real regulation around it. I am not confident here in the United States with this administration and understanding that. So we actually, unfortunately, might be better off with no regulation right now because I'm fearful of what this group of people who are not trained in this work might do. But
Okay.
it's a great tool that just needs regulation.
Okay. Thanks for that. Thanks for your insights there. And then finally, then tell us a bit about your other activity. Charity.
Yeah. So another thing, right? That's another space that I get poured into. So I am the chair of the board of Momentum Collective. And it is an organization based in Alexandria, Virginia, where we work to empower youth through the arts and education. So we have after school tutorials, but what we're most known for is our productions. Where we bring youth into the community, in from the community rather, and get them. It helps with their um, self-esteem because now you have these little quiet children on stage, becoming a whole personality. I used to perform, and I can tell you that was the funnest time because I got to be a completely different person from who I am every day. And so Momentum Collective, that's how Lyndon is also on our board, and Lyndon Taylor and Associates, that was the event that we met at. I also serve on the alumni committee for the alumni committee. I'm an alumni member of the board for Texas A&M, which is where I did my master's. And then let me see, there's one more that I have. Oh, yes, my favorite. So American School Health Association, I also serve on the board there. But my absolute favorite, I am faculty for the Skinner Leadership Institute, where we teach promise-driven leadership for African Americans who are in that mid career stage, or that 35 to 50, where you're learning how to present. So your schooling can teach you how to do your job. This is teaching you how to be a good person and be a promise-driven leader who has a higher calling. And so I am so fortunate. I'm an alum of the program, and so thankful that they saw something in me and have asked me to come back as faculty. So this will be my second year on the faculty. And it's my joy. I said, when I told them I might be moving to Dubai, they were like, but you have lectures. So we're working on how I'm gonna make sure I'm back in the
Your
States.
priorities right, Andrea, please.
But no, I truly love being able to give back and be a part of my community and building for those who are coming behind me.
Lovely. That's absolutely fantastic. Promise-driven leadership.
Yeah.
Well, that will be the debate, another debate on another time. When are you scheduled to finish your book?
So I'm actually meeting with a potential publisher. I'm so sad.
Are you on a promise for that one?
So I'm meeting with a publisher next week.
Okay.
I finished chapter. So right now my outline has 9 chapters, and I just finished chapter 7. So next week I meet with the publisher to see if she wants to read chapters 1 through 7 or wait till I finish the last 2. So we're going to talk about that. I would love to be able to have it on bookshelves and in February for Black History Month here in the States.
Next year.
Yeah. Wow. That's my goal.
Excellent.
February. Yeah.
Our Black History Month is this month.
This month. Oh, okay. Okay. I don't want to wait till next year for UK.
That's too far.
Y'all will get it though. You'll get it. I'll come. Look, I can come and do a book signing or whatever.
Yes. Let us know. Well,
yes.
It's been an absolute pleasure speaking with you. So inspiring, so honest, and yeah, learnt a lot, and no doubt our listeners will have learnt a lot from what you've shared today. Some of what you said really resonates because we have similar experience here in the UK, particularly as Black women. So all of that stuff, I'm sure. So is there anything that you'd like to leave us with that you didn't get an opportunity to mention in our talk today?
As gloomy as some of the topics we discussed today, I am still optimistic that there is a way for us to do better and that we'll get there. So it seems bleak right now, but I'm still optimistic. And that's what I would love to leave don't give up. Every piece that you do can impact a life. You may not know all of the terms and, be able to professionally tell somebody, go Google me so you know who you're talking to. You may not be on Google, but everything that you do makes a difference. And so I think if we all recognize what we bring and the impact and influence of our voice. So don't give up. We're gonna get this together.
Love, beautiful. Thank you so much.
Certainly. Thank you for having me.
Even if I'm falling down, I will keep on searching for my highs.